morning to all the people of Puerto Rico. Good morning to all of the press. Thank you for being here once again. We are here to update you on the current situation of Puerto Rico, what has transpired in the past 24 hours, where are we at in the critical priorities. And I remind you that our priorities at this juncture are to make sure that food, water, and other supplies gets delivered to the people of Puerto Rico, that we can have an effective rotation to have hospitals working so that they can give proper service to our most vulnerable, to make sure we establish communications and telecommunications as quickly and effectively as we can, to distribute and to provide energy to major important areas such as hospitals and water supplying, and air traffic control, as well as maintenance and accounting of the assets that are coming into Puerto Rico. I want to remind you that if you want to help Puerto Rico in any way, we have several vehicles to do so. United4PuertoRico.com provides a platform for anybody that wants to donate, as well as our 800 number. It's 202-800-3134. We want to report that in terms of the personnel, we have increased, the DOD has increased their presence from 4,600 about 36 hours ago to about 6,400. So as you can see, there is increased capability. Those capabilities are expected to increase, reach to a point where it'll increase and decrease depending on the necessities. Remember that the DOD is supporting on certain tasks and logistical tasks. So for example, if a task is finished, some of those assets might be retrieved, while if other ones come in, new assets might ensue. By the same token, FEMA has all of their personnel helping in different areas of logistics, distributions, making sure that generators are installed and getting to the appropriate places based on our priorities. I would also like to announce that I will be traveling today in some of the missions. Today we'll be going to Vieques and Culebra, as well as Añasco, to provide to provide services and food, and as well as to communicate with the leaders in those different areas. I would like to state that our dual status commander for the National Guard is General Reyes, and our state coordinator is Secretary Pesquera, as well as let you know that some of the updates on the different priorities that we are going to be working on. Number one, gasoline and the distribution of fuel. We've been increasing the number of gas stations that are open. We've gotten to a point where it's over 720 gas stations that are working, and that we are verifying that distribution gets there appropriately. The different providers have been working with the private sector to get transportation, make sure that during nighttime as well as the daytime they can be distributing fuel and it can get to the people of Puerto Rico. We also informed that we will be receiving more supplies in the coming days in terms of fuel, both in gasoline and in diesel. We expect that we will get 300,000 barrels of diesel by today, 100,000 of gasoline. Next couple of days, over close to 500,000 barrels of diesel, and close to 1 million of gasoline. So the flow is coming. Gasoline is getting here, and we have sustained levels as we use diesel and gasoline, but also are refurbishing it. So right now we're at close to 550,000 barrels of diesel in Puerto Rico, and 470,000 barrels of gasoline in Puerto Rico as well. I would like to reiterate to the municipalities that they can sign contracts with our general services account that will allow them to get fuel for their needs as a municipality. And this is critical because in this united front, in this collaboration, it is essential that we provide the services, the needs, so that municipalities can work appropriately and help in the supply chain that we're working on. So right now we have 16 municipalities that have gone into those contracts, and we hope and expect that more will be jumping in as well. I'd like to talk a little bit about the food and water supplies that are going around Puerto Rico and through Puerto Rico, and again, use it as an example of the importance of the collaboration between the DoD, FEMA, other federal agencies, the local government, our National Guard, and the municipalities. It is critical that we can establish what the needs are, what the expectations are, and that we can showcase that this food and these water are being delivered to the people of Puerto Rico. As you know, yesterday we received about 214 containers from FEMA that are being and will be distributed to the regional staging centers across Puerto Rico, as well as some particular missions that FEMA and that the DoD will embark on. I'd like to announce that yesterday 59 missions went out individually, aside from the missions that went to the regional staging areas for bulk food and for amassing the necessities for the different municipalities. 59 missions went across the different municipalities, 22 of them from the effort of United from Puerto Rico, from the Office of the First Lady, 13 from the National Guard, and 24 from FEMA and other federal agencies, as well as 2 efforts towards airlifting food and water to 2 communities or 2 townships that have communities that are very much so limited in terms of the access, and those are Utuado and Jayuya. Those 2 towns have had severe devastation in terms of their infrastructure. Some of the communities are disconnected, so one of the main efforts that the DoD will take on will be making sure that we can air supply some food and water to those communities while we establish a direct connection through the roads. I would also like to state that in this spirit and in the effort of collaboration, we have 11 regional staging areas, but there is an expectation now to increase those, hopefully above 25, and the expectation is in doing so in the next couple of days, that we start increasing that number from 11 to 25 and maybe more. It's a logistical issue. The more nodes that we have across Puerto Rico, the easier it is to get access to food and water from for these municipalities. So the DoD and FEMA and our government are working together so that we can establish some of these locations and make sure that food and water gets distributed appropriately across Puerto Rico. There are close to 600 federal emergency officers that are working these routes. So there's plenty of people, and I would like to state that the State Guard and the National Guard are critical in this effort. State Guard maintaining and running the regional staging areas, and the National Guard helping deliver some of the food and water supplies that are necessary for the people of Puerto Rico. So food and water is getting there. It is increasing. The logistics and the visibilities are increasing as well, although, as I've stated before, we recognize we still need to do much more. So we're getting everybody involved, from the government, from the non-for-profit sector, from the private sector, to be part of this effort so that we can distribute food and resources everywhere in Puerto Rico. Telecoms is another critical component. We've increased now to 36% of the clients having service in Puerto Rico. As I've stated before, the distribution was one of the critical factors. Most of the service was provided either in the metropolitan area or in the northeast part of the island. So our efforts right now have been to make sure we can get to those antennas in the parts that are not communicating, that we can establish either generators or fuel for those generators, or start with priority to align those antennas. We've been working with several engineers from the private sector to make sure that happens, but in the meantime, we're also establishing SATCOWs that will provide immediate coverage in different areas that right now are not covered. So in the past few days, we've done so for the areas of Arecibo and Ponce. That has increased, of course, the number of clients that has service. And today, we expect that our expectation is that we will do the same for Aguadilla, which is the northeastern part of the island, getting some much-needed communication to that part of the island. We reiterate that now that Fajardo and Ceiba are in, landline communications are 100% in full, and we expect in the coming 72 hours to install other SATCOWs on Fajardo, Rio Grande, Humacao, Sidra, and we're working on the potential of installing another one in Mayagüez as well. The total of people in shelter has been reduced. We're about at 8,800 refugees at this juncture, and 139 shelters. So again, going from 500, 10 days ago to about 139 right now. We're consolidating. We're making sure people get to their homes when they can get to their homes, and providing alternative housing in the meantime. We also state that FEMA has embarked on several missions to identify the damage assessments on the individuals. They go with their tablets so that they can get all of that data, and Alejandro will provide some of those stats once he gets a turn at the podium. In terms of the ports and the airports, today we expect to have 39 flights, passenger flights in Puerto Rico, and over 250 in general. That number again has been increasing from 6 that we had on the 22nd of September to 17 on the 27th, and now 35. Expectation again is within the next couple of days, hopefully under a week, we can get to maximum efficiency by getting about 60 of these flights. In terms of hospitals and healthcare and public health emergency, this is another critical aspect. We're attending to an emergency, but we're also preparing to prevent what could be other public health emergency crises. So it is important that we attend to our hospitals, that everybody knows where those hospitals are. You can see them at status.pr. All the information is there on the 51 hospitals that either are energized, which are 9 of them, or that are running on diesel fuel, and that have been prioritized by FEMA logistic loop so that they can get their fuel and operate effectively. HHS has identified and is working on preparing the super medical shelters with a capacity of over 250 patients in Mayagüez, Manatí, Bayamón, and San Juan, Fajardo being the only region where it still has that effort has not commenced. We expect that the USS Comfort will be here in Puerto Rico between the 3rd and the 4th. That will give Puerto Rico an additional an additional degree of freedom to get more patients, get service. The USS Comfort can take up to 1,000 patients. They could either be airlifted or the USS Comfort could dock. It depends on our necessity to move the USS Comfort across Puerto Rico versus the accessibility of flying patients from different regions of Puerto Rico. This is another example where the federal government, FEMA, HHS, DOD, local government, and municipalities need to have a critical loop and conversation so that we're updated continuously of what's going on. The DOD has established an effort to support logistics. We've identified that there are two major areas in Puerto Rico where we need to provide more healthcare or hospital support. The DoD will establish some alternative locations, those being somewhat in the southeastern part of the island and in the middle north of the island as well, so that we can get patients to hospitals and get the service that they need. 46 out of the 48 dialysis centers are now in the diesel loop. They're all, again, in status.pr so that patients can find it over there, or media can help communicate where these are. In terms of personnel, we spoke about the increase in presence of DoD support over here under the leadership of General Buchanan, but there's also efforts coming in from EMACs from different states. Let me give you an update on that. We have solicited about 25 EMACs. 12 of them are active. That represents about 1,200 people that will be helping in some capacity here in Puerto Rico, whether it's technical support or security. So we have, for example, we expect we have about 210 soldiers over here to assist police stations all across Puerto Rico. We expect to receive more New Jersey Police Department today. Yesterday, we got 4 Blackhawks from New York and their crew. And there's close to, as I said, 64,000 personnel from DoD as well in Puerto Rico. 6,400, yes. We've also received firefighters, police, and expect to receive much more today as well. In terms of energy and the energy grid and energy production, yesterday we informed the people of Puerto Rico and the press that we signed a mission assignment with the Army Corps of Engineers so that we can start the critical construction of energy access for the people of Puerto Rico, recognizing that our objective is to get energy as quickly as possible to most places, to the people of Puerto Rico, but without hampering the long-term view of generating a grid that is sustainable, that is modern, and that can mitigate some of the impact that we've had in the past. Yesterday, we got the Isla Grande Airport energized, the 911 system as well, Corrections Administration, the emergency management efforts, some hotels as well. And today, the efforts will go to energize the Corco terminal and continue on the efforts with the Valdoriotti Casa de Bombas. Those are some of the updates that I have. And also, finally, in terms of aqueducts, we have, and water access, a generator was installed in Manatee, which provides water to 4,400 people in Manatee. So some of these efforts in collaboration, again, with the DoD, with FEMA, and others are starting to produce some results. Those are the critical updates that we have, but also Alejandro de la Campa is going to give you some more granular details on the actions that the federal government has been taking. Alejandro.
Thank you, Governor. Good morning, everybody. We continue working in close coordination with the government of Puerto Rico, with the governor, all the state agencies, the municipalities, and private sector, private nonprofit organizations, because this is a whole community concept that we're working, all of us together, including DoD and all the other federal agencies. So I'll try not to repeat some of the updates that the governor just provided, and I will go through other areas or be more specific in some of the numbers. Our priorities, as I indicated yesterday, remain the same: saving lives, commodity delivery, fuel delivery and security, diesel delivery to hospitals, hospital assessments, restorations of the telecommunications, restoration of the electrical grid, and restoration of the water and sewer system. As the governor indicated, we have been distributing food and water to the 11 regional areas. So we continue doing that. Yesterday, we received a barge with a large quantity of water and meals, and they're being transported today to the regional staying areas. We started that process yesterday, and we'll continue today. And in addition, yesterday we were able to transport to 12 municipalities, direct transportation for food and also for water. And the municipalities were Jayuya, Vieques, Orocovis, Santa Isabel, Fajardo, Corozal, Canóvanas, Loíza, Orocovis, Lares, Utuado, Luquillo, and San Juan. So we're doing it both ways. We're sending to the regional staying areas, and such 57 municipalities have been going to the regional staying areas to pick up commodities. We are transporting directly to some other municipalities that for different reasons they're not able to go to the regional staying areas. This morning we were discussing with General Buchanan, Governor Rosselló, the new plan that we're planning to establish of increasing the number of regional staying areas, probably over 25, close to 30. That number will be determined based on the National Guard capabilities in the armory, so that way we can increase the delivery process. In terms of the fuel task force, we are currently refueling 31 medical facilities on a 3.5-day cycle per the Department of Health priorities. Yesterday, we provided fuel to 7 hospitals around the island. Today, we're providing fuel to an additional 8 hospitals all over the island, not just in the metropolitan area. We have the details for the media if you would like to have those details after the press conference. Related to the medical task force, 9 hospitals are now back on the grid power. 69 facility assessments have been completed. 50 facilities or hospitals are operational at this time. There are no pending assessments. As the governor said, 46 of the 48 operational dialysis centers are operational. 7 disaster medical assistant teams were deployed to the municipalities of Fajardo, Mayagüez, Ponce, and Arecibo. That was done yesterday. Today, we'll have additional disaster medical assistant teams deploying to different municipalities. Related to the utilities task force, we continue coordination with EPA, with HHS, FEMA, Department of Defense, to initiate planning for the isolated communities. We're working on a specific plan to address them. We have been able to address it on a daily basis, but we will like to have a comprehensive plan for those isolated communities that because of landslides, roads that have been damaged, it's going to be for a while until we can reach them. In terms of communication, the Fire Department New York is coordinated with the Puerto Rico Fire Department to restore communications, satellite phones requested to provide internet communication. So we have another example of the cooperation through EMAC of different entities, the Fire Department New York working with the Fire Department in Puerto Rico, and that's part of the whole community effort. We all need to respond. We all have a responsibility in this effort. Related to temporary power restoration, we continue with the installation in critical facilities. There are hospitals, there are water and sewage treatment plants, and other facilities that have been identified. Yesterday, we completed several installations across the island. Today, we will continue with the leading efforts of the Department of Defense, specifically the U.S. Army Corps of Engineers. Related to bulk water distribution, yesterday we delivered 30,000 gallons of water to 14 dialysis centers and 102,000 gallons of water to several hospitals around the island. In addition, the Puerto Rico Aqueduct and Sewer Authority has several oasis locations around the island to provide water to the families. Airport operations. Roosevelt Road status is capable of former Roosevelt Roads, Ceiba Airport, capable of 24-hour operations, and airfield is under the Air Force Command, and we are conducting most of our operations now from the Ceiba Airport that is becoming our incident support base. As the governor indicated earlier, the San Juan Airport is open for business and is capable of handling over 250 flights per day. In terms of assistance to the families and individuals, we have received over 63,000 applications since Hurricane Maria, and we have disbursed close to $7 million to the families that apply for assistance from FEMA, and this covers the entire island. As we have indicated earlier, we're sending our teams to areas where there's no telecommunications with electronic tablets, so they can take registration from of the families and individuals around the island, and that's why we have that large number so far of 63,000 applications already across the island. That includes all municipalities, and is in a way, thanks to our teams going out and taking registrations, even in municipalities where there's no telecommunications. Now I would like to talk about the effort that other agencies are conducting that are very important, and those are the private nonprofit organizations, because they're doing an outstanding job in support of FEMA, in support of the government of Puerto Rico. So we are coordinating closely with voluntary agencies for distribution of emergency supplies to remote areas of concern. For example, the Lions Club in Puerto Rico and the Department of the Family yesterday distributed 600 food boxes to the municipality of Maunabo, and they will continue doing that today. Heart to Heart, another private nonprofit, have performed taking care of hospitals and taking care of patients in the municipalities of Caguas, Calley, Bonito, Barranquitas, and Jayuya. We have the Salvation Army that delivered 6,000 food boxes in 7 locations throughout Puerto Rico. American Red Cross distributed in the last 24 hours 7,000 liters of water and 25,000 meals to the municipalities of Toa Alta, Toa Baja, Hatillo, Naranjito, Vega Baja, and Quebradillas. And they are also planning, the American Red Cross, to distribute food and water to the municipalities of Humacao, Trujillo Alto, Utuado, and Comerío. The Department of the Family distribute 4 trucks with 600 food boxes to Yauco and Maricao, and completed their missions to Orocovi, serving close to food and water to over 400 families. The Department of Agriculture distribute food for 100 individuals in 6 shelters located in Manatee. And Feeding America is working with the Puerto Rico Department of Agriculture to obtain 57 additional trucks to serve 1,600 food boxes from the Department of Education Federal to senior citizens living centers. Save the Children distributes school supplies to 5 shelters in Bayamón. So you see that it's not only FEMA, it's not only DOD, this is a whole community. We all are supporting the efforts across the island. In terms of infrastructure and support to the municipalities, we have been able to approve over $21 million to the municipalities to cover some of their initial responses under the public assistance program, and we will continue approving funding to the 78 municipalities. U.S. Army Corps of Engineers continue with their missions of generators installation, debris removal operations, and the tarps. The blue plastic sheeting. Yesterday we initiated that process, and some municipalities already came to our distribution center to pick up plastic sheeting. There were the municipalities of Dorado, San Sebastián, and Cayey. And today we have additional municipalities that will be coming to our distribution center to distribute those tarps. In addition, we will be transporting them along with the water and the food to the regional staging areas. With that, complete my report. Thank you.
Thank you, Alejandro. And now I will just briefly make remarks in Spanish. Como habíamos establecido, tenemos las mismas prioridades. Prioridades: llevar agua, comida, combustible, establecer las telecomunicaciones, tener los hospitales funcionando y trabajar con los acueductos y el sistema de tráfico aéreo para poder tener más recursos aquí en Puerto Rico. Así que hemos estado trabajando en un frente de comandos unidos en las prioridades que hemos establecido nosotros con el apoyo de FEMA y el Departamento de Defensa para poder ejecutar. Le informamos al pueblo de Puerto Rico que ayer en algún momento teníamos 4.600 personal del Departamento de Defensa, ya eso ha ascendido a 6.433. Informamos que nuestro Dual Status Commander es el general Reyes y que nuestro coordinador estatal es el secretario Pesquera. Hoy estaré yendo a Vieques, a Culebra y a Añasco para algunas misiones y también para identificar lo que son las necesidades, particularmente en las islas municipios. Debo añadir que ya se han hecho varias misiones a estos municipios, pero ciertamente estaré hoy para poder participar. Sigue aumentando, ¿verdad?, el flujo de la gasolina, la distribución de la gasolina y del diésel. Tenemos niveles sostenibles ahora en Puerto Rico y todavía van a seguir entrando más por barcaza en los próximos días. Por lo tanto, estamos estamos por encima de 500,000 de barriles de diésel. Estamos un poquito por debajo de 500,000 de barriles de gasolina, pero vamos a estar recibiendo también buques adicionales hoy, mañana y en la próxima semana que van a estar suplementando esa necesidad. De la misma forma, reitero que la distribución de comida se está efectuando a una eficiencia mucho mayor. Ayer se llevaron a cabo 59 misiones a municipios, sin contar lo que son las 11 misiones para los Regional Staging Areas, donde los municipios pueden buscar información, buscar los abastecimientos. Hay dos municipios particulares, que es Utuado y Jayuya, que tienen mucha dificultad en algunas áreas para llegar a ciertas comunidades y por lo tanto el Departamento de Defensa ha estado volando para llevar suministros y comidas, en lo que se pueden entonces habilitar pasos seguros para los camiones y los carros para que lleguen a estas comunidades. De la misma forma, ayer llegaron 214 contenedores que se han estado distribuyendo, en adición a los contenedores que nosotros hemos cogido del sector privado para distribuir a través de todo Puerto Rico. Se ha establecido una colaboración con el Departamento de Defensa, el FEMA, el gobierno central, para aumentar lo que es el número de los Regional Staging Areas a través de Puerto Rico de 11 a potencialmente 25 o un poco más. La idea es tener nódulos a través de todo Puerto Rico, unos nodos para que la distribución sea más eficiente, particularmente para esos pueblos que se les hace más difícil llegar. Así que durante los próximos días se van a estar evaluando esos Regional Staging Centers para poder abrirlos y que la ciudadanía pueda tener acceso más fácil a comida. Las telecomunicaciones han aumentado, hoy estamos en 36%. Los landline, ¿verdad?, las líneas fijas están en 100%, entrando Fajardo y Ceiba para Puerto Rico. Se han levantado 230 antenas. Hace 36 horas eran 180 y hace poco más de 48 eran 96, así que se está haciendo progreso en ese sector. Se están estableciendo los SAT-CAUs, ya se hizo en Ponce, en Arecibo, hoy se estará haciendo en Aguadilla para proveerle servicios a estas regiones que no tienen telecomunicaciones hoy, y para darle un radio de comunicación, ¿verdad?, a esos municipios. El número de refugiados ha disminuido, estamos en 8.800, en 139 refugios a través de todo Puerto Rico, por la cual ¿verdad? Se están llevando o a sus hogares o a áreas provisionales ¿verdad? Temporera para entonces habilitar lo que sería el próximo paso, si es reconstrucción de hogar, si es vivienda temporera, entre otras cosas. Los aeropuertos han estado aumentando el flujo de los vuelos, debo decir. Ya son 39 vuelos, Luis Muñoz Marín, de pasajeros y sobre 250 en términos de la capacidad que se tienen. Los contenedores, ¿verdad? Y los transportistas siguen yendo a los puertos, que es una de nuestras primeras preocupaciones, y ahora ya se está llegando a algunos niveles sostenibles en ese frente. Los hospitales, tenemos 51, están en el loop de diésel prioritario de FEMA. Se está trabajando también con el Departamento de la Defensa para poder allegar activos a esos hospitales y para poder tener también el USS Comfort, que se espera que esté aquí entre el 3 y el 4 de octubre. 46 de 48 centros de diálisis están ¿verdad? activos y se están incluyendo en el esfuerzo prioritario de distribuir el combustible. Vamos a recibir más activos de seguridad. Ya hemos recibido cientos de activos de seguridad. Con las solicitudes de IMAX, hemos tenido 25 solicitudes, 12 están activas, 34 se están revisando, 13 se están revisando, y eso representa, ¿verdad? Los activos ya representan 1.200, ¿verdad? Personal de seguridad, técnicos, médicos, entre otros, que van a estar viniendo a Puerto Rico de los estados. En términos de energía eléctrica, se ha comenzado con energizar áreas, ¿verdad? Ayer como Isla Grande, el sistema 911, entre otras áreas, y de la misma forma pues se mantiene la prioridad de energizar el terminal de Corco. Se llegó a un acuerdo con el Army Corps of Engineers para ayudar en la reconstrucción, particularmente en la fase de emergencia del sistema de energía, para poder proveerle al pueblo de Puerto Rico energía de la manera más rápida, pero sin comprometer el diseño, ¿verdad? Y la capacidad de hacer un sistema de energía que pueda mitigar estos impactos y que sea moderno y efectivo para el pueblo de Puerto Rico. Y de la misma forma, en acueductos se han estado implementando, evaluando los generadores, con FEMA se han estado llevando, y ahora con una misión del Departamento de la Defensa, pues van a estar haciendo el loop para asegurarse que tienen combustible y que tienen mantenimiento adecuado. Así que eso es la actualización. ¿Verdad? 2 puntos adicionales. Ayer me comuniqué con el presidente y el vicepresidente de los Estados Unidos para ¿verdad? Darle la actualización, seguir estableciendo lo que eran las prioridades y los resultados que habíamos tenido hasta ahora. Me reiteran su compromiso para seguir ayudando y trayendo todos los esfuerzos aquí pertinentes para el pueblo de Puerto Rico.
Good morning. We will take some questions, one question per media outlet. We will start with Noticentro.
Hola, buenos días.
Buenos días.
Gobernador, usted acaba de dar ¿verdad? El informe del día. Sin embargo, ahí, insisto, hay alcaldes y hay personas que han llegado hasta el centro de convenciones sobre que la ayuda no está llegando. Acaba de decir que se van a identificar unas áreas para que entonces los municipios lleguen. ¿Cuáles son los pueblos más afectados según la evaluación? ¿Y cómo se está llegando a esas comunidades? Porque hay muchas que están incomunicadas y la verdad es que la gente no...
Claro.
Hay sectores que no están recibiendo la ayuda y es una realidad, por más esfuerzo que haya y por más suministros que estén llegando a este punto.
Sí.
Y la Junta retiró lo de la demanda de la reducción de jornada laboral. Quería saber su reacción.
Sí, la logística de esto es enorme, ¿verdad? Y por eso es que es tan importante la colaboración con los alcaldes. Porque si cogemos, por ejemplo, los sectores en Puerto Rico, pues entonces es una tarea mucho más compleja, sobre 3.000 sectores, que buscar a los municipios. Nosotros hemos identificado a los alcaldes para poder hacerles llegar los recursos, ¿verdad? No obstante, reconocemos que hay regiones, ¿verdad? Hay áreas que se le ha hecho más difícil el acceso, pero los regional staging areas están ahí para que los alcaldes puedan ir a buscar, y entiendo que un gran número de alcaldes ha ido a buscar estos recursos en estos regional staging areas. Hay como 12 al momento que no han ido. Obviamente nosotros tenemos prioridad en comunicarnos con esos alcaldes para ver si es una cuestión de limitación de transportación y que podamos hacer llegar los recursos. Pero ayer a 59 municipios, y esto de nuevo está constatado, lo pueden ver en las redes sociales, los distintos grupos que están trabajando, las misiones oficiales, por decirlo así, fueron 59 misiones. 59. Encima de eso están todas las misiones, ¿verdad?, que hizo el non-for-profit sector, Red Cross, ¿verdad?, la lista que leyó Alejandro de la Campa. O sea que sí hay comida, ¿verdad?, sí se está llevando a todos los municipios. Se está haciendo, ¿verdad?, ya básicamente cubrimos a Puerto Rico casi en totalidad una vez al día, ¿verdad? O sea, 59 municipios oficiales más los otros municipios, y coordinamos obviamente para que pueda existir esa logística. Establecemos que hay 2 municipios, ¿verdad? Cuando me preguntan los más difíciles, Utuado y Jayuya, tienen unas comunidades que han sido identificadas que tienen una dificultad significativa en poder allegar los recursos. Y por lo tanto el Departamento de Defensa está sobrevolando y llevando esos recursos hasta tanto y cuando pues entonces se pueda tener acceso vial. Hay muchas comunidades que tienen acceso dificultado, ¿verdad? O sea, por ejemplo, la montaña fue severamente afectada desde Barranquitas, Orocovis, Morovis, Comerío, Naranjito, Corozal. Todo ese litoral fue afectado, y hay más municipios, ¿verdad? No me quiero limitar. Villalba fue afectado significativamente, y nosotros sí estamos dando prioridad a llegar estos recursos y estos camiones para esos municipios. Hoy saldrán otras misiones que nuestra expectativa es que sean mucho más todavía que las de ayer. Así que se está llevando a cabo. Solicitamos, ¿verdad?, encarecidamente la colaboración y la comunicación con los alcaldes. La gran mayoría de ellos se están comunicando efectivamente, están llegando los recursos allí, pero vamos a trabajar y vamos a redoblar esfuerzos con otros oficiales electos para que también sean parte de la red y que aseguren, ¿verdad?, y que le puedan comunicar a sus constituyentes y al pueblo de Puerto Rico que en efecto estos suministros están llegando a los municipios y se están dando. Y por último, solamente un dato para que entiendan la magnitud de lo que estamos enfrentando, ¿verdad?, y de la crisis aquí en Puerto Rico. El huracán de comparativa en la historia moderna con Puerto Rico de lo que había ocurrido ahora era Georges en el 98. En aquel entonces, al igual, FEMA estaba aquí, y al igual que ahora, pues se mantiene una bitácora de cuáles eran los recursos que se habían utilizado. Lo que se llama el burn rate, ¿verdad?, el nivel que se ha consumido la comida y el agua, para comparativa aproximada, lo que se ha consumido en estos 11, 12 días es ya igual a lo que se hizo por 3 meses, por un periodo de 3 meses cuando estaba Georges, demostrando, ¿verdad?, que esto es una situación mucho más compleja, mucho más severa, que sí la comida está llegando, pero también que tenemos que atenderla con mayor intensidad y que seguimos atendiéndola con mayor intensidad. Y sobre la Junta de Supervisión Fiscal, pues solamente digo, en términos de retirar la demanda, mi agradecimiento por reconocer que esto es diferente, esto es un panorama diferente y que nos tenemos que enfocar en otras cosas. Las prioridades han cambiado. Todo el mundo que ha estado aquí lo reconoce, y me alegra saber que los miembros de la Junta también lo reconocen así.
I have to reiterate one question per media outlet because we are a lot of journalists. Foro noticioso, foro noticioso.
Buenos días, gobernador. Con relación a los cadáveres que estaban en los hospitales, que los han pasado quizás ya al Instituto de Ciencias Forenses, ¿cómo han logrado comunicarse con los familiares para que lleguen hasta allí?
Bueno, en términos de la comunicación ha sido un reto. Obviamente se le ha dado prioridad. No tengo el número de cuántos se han comunicado. Sí, les puedo informar que nosotros, por ejemplo, ayer tuvimos una reunión con la Asociación de los Hospitales, porque obviamente hay mucha información por distintas áreas. Lo que nosotros queremos es constatar que esa información es correcta, ¿verdad? Y entonces certificarla para poder proveérsela al pueblo de Puerto Rico. ¿Verdad? Ya el instituto está energizado, ¿verdad? Por conducto de un generador, pero está energizado. Se tienen 4 freezers adicionales y se tienen las 2 unidades de la Guardia Nacional especializadas ¿verdad? En asuntos mortuarios para poder trabajar lo que son los cadáveres.
NPR.
Morning, Governor. Along those lines, when will you all update the number of deaths
Yeah.
related to Hurricane Maria? As she said, doctors are reporting around the island that there are cadavers in their morgues. We're hearing more and more of this. It's in hurricanes, the number tends to go up and up, especially with a dramatic storm like this. It's hard to imagine that there were only 16 or 19 deaths related to the storm.
I get it, and I've always said that as soon as we get more information, we will provide it to you. Our message has been consistent. This was a devastating event. Obviously, you hope that the number doesn't rise, but you recognize that is a possibility. Our Inside Commander, Secretary Pesquera, has been dealing with this situation head on, so I would like for him to make some comments on the granular level.
Yes, sir. Thank you. Good morning. We talked to all the hospital owners or managers, whatever, and we can only certify 16 deaths related to the hurricane. We're still reviewing those deaths that occur at hospitals to see if there's any connection whatsoever with the hurricane. However, there's been a lot of rumors out there that there is hospitals that were closed because of the energy situation that had bodies in their morgues. That is not the case. We have reviewed each and every case, and we've talked to each and every of the hospital managers. That was not the case, and I think yesterday I cleared it up because that was a rumor, a persistent rumor, and I want to make sure that it's taken care of.
WIPR.
Muy buenos días, gobernador. Le pregunto, hablaba que tuvo una reunión con la Asociación de Hospitales. Hay mucha preocupación por personas que están siendo estabilizadas en los hospitales y van a ser dados de alta porque ya están estables, pero que a lo mejor necesitan, por ejemplo, en el caso de un asmático, mantenerse dando terapias cada cierto tiempo y en sus residencias no tienen plantas eléctricas, no tienen manera de poderse dar el tratamiento. ¿Se habló de cuál va a ser entonces el manejo de esa parte de la salud?
Sí, hay varios componentes que van a ir añadiéndose, ¿verdad? A la medida que transicionamos de la emergencia a la estabilización. Por ejemplo, se van a estar creando los que son los super shelters, ¿verdad? Los super refugios, por decirlo así, que van a estar energizados, van a tener personal de DMAT y que van a estar, ¿verdad? Van a permitir atender estas situaciones de salud de distintas poblaciones vulnerables, asmáticos, personas que puedan tener diabetes, personas que sean envejecientes, que necesiten ¿verdad? Algún componente, o sea que eso se va a estar trabajando. De la misma forma, hemos comenzado, ¿verdad? El esfuerzo de identificar, y esto con la colaboración de los municipios, lo que son todos los distintos asilos para los envejecientes, para también darle una prioridad, aunque hemos dicho, ¿verdad?, que aquellos pues los puedan llevar a hospitales que están funcionando o super shelters. Ahora, ¿verdad?, de poder hacer llegar las medicinas y los tratamientos que son necesarios al pueblo de Puerto Rico. Por eso la comunicación no es solamente la distribución de diésel con los hospitales, 51 hospitales, ¿verdad? Ahí tenemos personas de DMAT, tenemos personas del gobierno del Departamento de Salud, tenemos personas de FEMA que están en rotación para continuamente saber cuáles son las necesidades, buscarlas y poder suplirlas.
Una pregunta por medio de Telenoticias.
Muchas gracias. Buenos días, señor gobernador. I'll ask the question also in English for my colleagues, English-speaking colleagues. It's regarding la visita del presidente de los Estados Unidos. En un momento donde los recursos están limitados, parecería que el terreno todavía está sensible. ¿Cómo armonizan esos elementos? Seguramente la policía local y otros elementos que hacen falta para que esa visita se cumpla con todos sus requisitos. I'm asking in regards to the visit of the president this week, how does that as in a sensitive terrain right now on the limited resources, how does the local government work around that? How those two elements compare, and what benefits can we get from his visit during this crisis?
Right. Well, first of all, the president will come with a lot of the resources that will maintain, that will address the logistics as well as the security. Number one. Number two, why is it important? I think it's important that the chief executive of the United States sees firsthand what's going on in Puerto Rico. Number one. Number two, his visits demonstrate his visit and the vice president's visit later on, as well as visits of other governors such as Cuomo and Scott, demonstrate that there is interest to help the people of Puerto Rico move past this emergency and move past this catastrophe. Third, I would say that his visit over here to all of the DOD and the federal employees is very important. Federal employees from the emergency side have been stretched by three disasters in the past month and a half. So it is important that your chief executive comes, sees the work that you're doing and recognizes the work that they're doing. And I think for the people of Puerto Rico, it's important to see that even though this has been a catastrophic situation, and even though we need to do more, the president will be here, and he has not forgotten about the U.S. citizens of Puerto Rico.
One question per media outlet CNN.
Lo doy rápido. Sí, rápido. I'll go with you now. Okay. Sobre la logística, el presidente trae su propia logística, ¿verdad? O sea que eso no debe ser una consideración mayor. Obviamente aquí las fuerzas van a estar enfocadas en el trabajo que hay que hacer y su visita es relativamente rápida, ¿verdad? Pero es importante porque al pueblo de Puerto Rico le deja saber que el presidente sí está preocupado y sí está enfocado en resolver los problemas de Puerto Rico. Segundo, a los oficiales federales que ya están cansados, como muchos de los oficiales locales, ver a su primer ejecutivo aquí envía el mensaje correcto. Y tercero, es importante que el presidente vea de primera mano cuál es el daño extenso para el pueblo de Puerto Rico. O sea que yo veo que sí tiene ¿verdad? Un beneficio. Sí, le podré comunicar ahí las necesidades, ¿verdad? Que yo veo que es las acciones que se tienen que tomar a la medida que yo he estado comunicándome prácticamente a diario con él, pero que lo pueda ver, que se pueda establecer y que podamos seguir desarrollando los pasos a seguir. Y el vicepresidente que viene el viernes también. Yes.
CNN. President Trump tweeted this morning that all buildings have been inspected. Can you confirm that?
All buildings
have been inspected. Does that only pertain to government buildings or all structures?
I'm not aware of such inspection. Of course, there are areas of Puerto Rico which we haven't really gotten contact. Perhaps he was referring to a particular set of buildings. I'm not sure what the context of the message is.
CBS.
Good morning, Governor. Just since you've been talking this morning, the president of the Ponce Research Institute sent a message saying we desperately need supplies in Ponce and in the areas around it. In Lares, there's a man who says they've been using a kid's swimming pool to get water, rainwater from the roof that they've been drinking. Now, you said this morning that we're doing as much as we can, but we need to do more.
That's right.
It is still an emergency situation 11 days after this hurricane. What more can you get? What more than do you need in order to move this past an emergency?
People, which we're getting, resources, which we're getting, and fine-tuning the logistics of a new logistical system in Puerto Rico because the roads have been decimated. Let me put this in context, all right? And any state that would have passed through the situation that Puerto Rico passed would have had as many challenges or similar challenges to us, and any state passing through this situation would have needed the full support of anybody that was willing to do it in terms of logistics, supplies, and so forth. Of course, we've talked about early and often about how the differentiating facts of Puerto Rico. We're an island, limitations that we had, the strength of the hurricane, the ferocity of it, the impact that it had on all of the island. But I think it's I think it's a moment that I invite everybody to reflect. I invite everybody to reflect on this situation. I know this might not get to everyone, but nonetheless, I really want to communicate this. I invite you to reflect on why Puerto Rico is in the current state of disadvantage and inequality. It is not something that happened just a few months or a few weeks prior to the storm. It is a condition that has happened for more than a century in Puerto Rico. I invite you to reflect on the reality that even after the storm hit Puerto Rico, and even when it was evident that it was a disaster in the United States, only half of our U.S. citizens in the mainland knew that Puerto Ricans were U.S. citizens. I invite you to reflect what it means that because of our condition, and most so in this current situation, that Puerto Ricans, the U.S. citizens in Puerto Rico, receive 1/3 of the funding for health care, as would another citizen receive it in the United States. I invite you to reflect and ponder on the reality that, in essence, half of our population, a population in the United States, lives under the poverty level. I invite you to reflect and to consider that Puerto Rico has had one of the highest per capita participation rates in our military and armed forces compared to all of the states, and right now we have over 150,000 veterans over here that don't get equal treatment just because they live here in the island. During this catastrophe, the President, the Vice President, state governments, congressmen, on a bipartisan or a nonpartisan effort, have responded to the people of Puerto Rico. Governor Cuomo came over here early and brought resources. Governor Christie, as well, deployed immediately, as well as other 17 governors that have pledged their help directly to the people of Puerto Rico. We have spoken to senators, congressmen, congresswomen that have their commitment to help Puerto Rico in an aid package that has the critical elements so that we can get through this emergency and start rebuilding effectively. And these go all the way from Ted Cruz, Marco Rubio, to Leader Schumer and Cory Booker. They have pledged their support now. I know that there is more that we need to do, but it is important that we recognize that the President, state governments are helping, are putting their resources, and just because one of them or some of them haven't put it on a tweet does not mean that they are not working for Puerto Rico. I am here to tell you, as Chief Executive of Puerto Rico, that they're working, and that they're working tirelessly so that we can get all of the resources. So I invite all of you to consider, to think of Puerto Ricans as your constituents. Think of Puerto Ricans as constituents of your own state. Think about it as a moral imperative, because we are U.S. citizens, but more importantly, because we're all equal as human beings. And if we don't consider that, because of the inequality that exists, because of the grave challenges that we have to embark on, then that presumption of thinking of Puerto Ricans as your constituents might come true because of the massive exodus that it will provoke. So now, this generation of Puerto Ricans has had to take on a challenge far greater than others in the past. We had a fiscal situation, a decaying economic, slumping economy for decades in Puerto Rico. We have a fiscal oversight board. We have zero access to the markets. And on top of that, we have two major disasters coming to Puerto Rico back to back. I know that this is a huge challenge. I know that this is a huge challenge. But I implore you that, to everyone, to look at this as a nonpartisan solution, to forget the fighting, and to focus on outcomes. And by doing so, we will get out of this emergency. We will make sure that we stabilize Puerto Rico. And by doing so, you will be part of the generation that helps Puerto Rico come out of this stronger than ever.
El Nuevo Día.
Buenos días, gobernador. Usted mencionó que se iban a estar estableciendo 2 centros de salud temporeros en el sureste y en el norte. Quisiera que me diera un poco más
¿Centros de salud?
Como hospitales,
no,
fue lo que entendí.
No, ok. Buena pregunta. Esas son las regiones que están un tanto más afectadas, ¿verdad? Tanto en términos del acceso al hospital como en términos de, ¿verdad? Del impacto que se tuvo en el huracán. Partes del sureste y partes del centro norte, ¿verdad? De la cordillera y de las montañas. Lo que se está trabajando con el Departamento de la Defensa es que se está estableciendo un mecanismo accesible, ¿verdad? Para que estos pacientes se puedan transferir y puedan tener estos hospitales, ¿verdad? O capacidades de hospitales cerca de ellos y que se puedan atender esos pacientes. O sea que es una logística que se está trabajando con el general Buchanan para poder entonces asegurarnos que en estas regiones que están, ¿verdad? Presumiblemente más afectadas, le podamos tener todo el acceso a hospitales y a medicinas que así van a necesitar.
ABC News.
Thank you, Governor. This might actually be a question better answered by FEMA, the FEMA representative, regarding hospitals throughout the country. Specifically, you said that there were 50 operational hospitals. What do you mean by operational? And then you also mentioned that there were 2 hard-hit areas of the country, the southeast and the north-central part of the island. What's happening in regards to hospitals in those areas?
Yes, the Department of Health and Human Services, Federal, have been conducting assessments around the island to all the hospitals. And the assessments results were what I mentioned earlier, that the number that I reported earlier are the ones that are operational. That means that either they have electricity. At this time, we know that only 9 hospitals or 9 facilities, they have electricity. The others are using generators, and we are refueling them with diesel. Related to the most affected areas, the governor has been clear many times that is the southeast and the south part of the island. That's where the eye of the storm entered, and that's when the areas that created destructive damage to the municipalities, to the electrical grid, to the homes, and to other public facilities.
Revista de Salud Pública.
Gobernador, para Medicina y Salud Pública, ¿cuál es la logística del Departamento de Salud para estos brotes que se han confirmado de conjuntivitis y de impétigo en algunos de los refugios? Sabemos que los sitios con hacinamiento pues son propensos para estos riesgos. Y también la Academia de Médicos de Familia nos confirmó que hay más de 200 médicos de familia sin práctica clínica. ¿Cuál es el enlace con el Departamento de Salud y el Colegio de Médicos Cirujanos para también ayudar a restablecer la práctica clínica de estos médicos? O sea, sin médicos no existe la salud del paciente.
Sí, por supuesto. En términos de esa pregunta, ha sido una prioridad con ¿verdad? El gobierno federal y con el Departamento de Salud, identificar todos esos daños para poder ponerlos a operar rápido. Reconocemos que ahora hay unos retos de salud, pero que pueden ir evolucionando, y a la medida que pase ello, pues vamos a necesitar más médicos para poder tenerlos. De la misma forma, para atender los posibles brotes, ¿verdad? Y los posibles problemas de salud que se vayan a ir desarrollando, pues para eso hemos solicitado refuerzos federales, ¿verdad? Lo que se llaman los DMATs, ya están aquí, ya están en 7 regiones en Puerto Rico, siguen llegando más para ir estableciendo, ¿verdad? no tan solo la logística ante el daño, sino poder mitigar de antemano lo que pueda ser algo controlado a lo que pueda ser algo ¿verdad? Que sea expandido por todo Puerto Rico.
We conclude the press conference. Thank you.
Thank you.
We're excited about the fact that we're wrapping up our final preparations to get underway here at about 1 o'clock this afternoon and have the opportunity to deliver a pretty unique medical capability that no Navy in the world has the capability to do. And that's where a guy like Captain Buckley behind me brings that medical capability. And any of the questions with specific medical capabilities, I'll let Captain Buckley answer those. My function will be to go down and help with the command and control coordination between the Maritime Component Commander and the Land Component Commander there. Basically, think of my role and the role of my staff is to keep everybody out of the way so that the medical professionals can do their jobs. And so I'm pretty good at that, and they're really good at what they do. And then, subject to your questions, I would just turn it over to Captain Buckley to talk about capability.
Captain, seeing the ocean conditions and weather conditions usually here in Puerto Rico, how long do you think it'll take you? What do you expect in your voyage?
So the conditions are pretty good right now. The seas started laying down yesterday. We think that the transit will take, we should be on station by 3 October. If we have to slow down a little bit, 4 October at the latest, but I'm pretty confident we'll be there by the 3rd. So we don't know where we're going yet. The those final mission analysis and coordination with the national level agencies is ongoing. We'll get our orders en route, and wherever we go, what the great part about what Comfort brings to the fight is the ability to move anywhere that they ask us to go.
Can you talk to us about challenges because of the devastation at the island? Is that going to be a challenge for you guys? I know the FEMA administrator said getting to port was kind of a challenge for you guys to even get underway in the first place.
Again, that's part of the mission analysis that's still going on. As you can imagine, with the level of destruction that occurs from a Cat 5 hurricane or Cat 4 or whatever it was when it made shore, we're very cautious about how we bring a large ship in. And so those surveys are still ongoing. We're working with our Coast Guard counterparts that are down in the area to get that assessment. And so we are flexible. The medical capability that the ship can deliver can be done underway, it can be done in port, or it can be done at anchor. And so between the helicopter capability that we have, the boats that we have, all of those things together give us the ability to be flexible in our mission and still contribute with very little interruptions in that process.
Given the issue with going inland once you're there, the infrastructure damage, is that a challenge? I suppose you'll be using helicopters a lot to get stuff back there.
So I mean, the part about that for us is, you know, if we go pure side, then there's that challenge of things are going to have to move by truck. The assessments that are coming out of there, you know, are mostly what I hear on the news as well, and that is, you know, there's some areas that we're starting to do it. There are issues with or challenges with fuel distribution and things like that. You know, we're flexible enough to do that, and what one of the capabilities that we have is, should we have to go out and restock or something like that, we could leave port for a very short period of time, go out there and meet underway replenishment with our other Combat Logistics Force ships and be able to do those resupplies. So again, that goes to the flexibility and the uniqueness of comfort going into an area like that.
Do you have any idea how long you'll be gone?
So I know that my orders are a minimum of 30 days. You know, and again, those are decisions that are made much above our level. What we'll do is we'll go out there and hit the ground running, or hit the deck plates running, as we say in the Navy, and we'll keep moving until somebody tells us that we're no longer needed.
Is 30 days pretty similar to previous missions for comfort?
So I don't know enough about that, to be honest with you. I think when you look at the U.S. response that's going in, now that things are starting to get mobilized and we're able to make the assessments that we make, you know, my initial cut is 30 days seems to be about right for this mission.
When was the last time Comfort deployed?
So,
Continuing Promise 2015.
So 2 years ago?
They went to, I think, 13 countries approximately, and saw 122,000 people.
Any reason why now it's being deployed to Puerto Rico, that's in Texas or Florida? So any of the specifics with this, why you guys are getting out?
So, you know, those are decisions that are national level decisions. You know, decisions made well above my pay grade. I can only say that we've received the order to go, and it's time to go. What decisions were made at the national level, I'm not privy to that, and I wouldn't feel comfortable trying to answer, you know, why decision makers made those decisions.
Captain, how do you feel about the fact that there was a petition drive to literally send the Comfort that started several days ago? Anything you would say about that?
You know, again, I'm a simple sailor from Chicago. You know, my job is to, when somebody tells me to go, I go. All of the rest of it is frankly irrelevant to me. We have a mission to go deliver a capability and get involved in an operation to reduce human suffering in an area that has been devastated by weather over the last 5 to 6 weeks. That's all I'm focused on, and that's all that my medical professionals that I'm going with are focused on.
What is it like gearing up to get ready once you get the word to go? Just getting a ship like this ready to deploy on short notice?
So that, you know, that's a great question. So to understand that, you have to understand how the ship is designed in a non-operational status, right? So this ship is normally maintained in what we call a reserve operating status 5, which means they can get the order and be ready to go in 5 days. Now that's from the civilian mariner standpoint, and then the uniqueness about Comfort is that we can tailor those medical packages that Captain Buckley can talk about a little bit more in depth here. And typically that's a 5 day or plus process depending on the size of that package. You know, we started posturing as we saw weather coming in. We were leaning forward in the event that we were asked to go, especially as Irma was approaching the United States. And so we made some of those preparations, decisions that were made within the Navy to do that. Here's what's really unique. 48 hours ago, there were less than 100 people on board this ship. That's civilian mariners and medical treatment facility personnel at the same time. Over the last 36 hours, we have flown medical professionals in for that tailored medical package, along with their support personnel from all over the country, and the number of people that are on board right now are over 800. Think of the logistics that's required and the capability that's required to move over 700 young men and women and you know, good Americans to come on board and drop what they're doing to go and deliver that capability. I couldn't be more proud of how Military Sealift Command, how the medical community have responded, and to walk aboard the ship or talk to those sailors who were all ready to go. You know, that's what keeps you coming back to work every day. Y'all probably want to talk to the other guy, so I can get out of the way unless there's any more specific questions for me.
For the cameras, can you state your first and last name again and your rank?
Yes, my name is Captain Kevin Robinson. I'm the Commodore of Military Sealift Command Atlantic and the Task Force Commander. And on board here, I am the forward command element for comfort to fall in on the other military commanders that are in the area. Okay. Yeah, sorry. You got him? You good? Taking my wallet?
Yeah.
Pickpocket. Good morning. I'm Captain Kevin Buckley. I'm an emergency medicine physician with a subspecialty in pediatric emergency medicine. I am the commanding officer of the hospital, or they call the MTF, Military Treatment Facility, on the Comfort. Captain did a good job of giving you some of the overviews. I can give you a general spiel of what we can do, or you can ask me questions. What would you prefer?
Captain, can you compare your capabilities with the most advanced hospital that's in Puerto Rico right now that's operating?
Well, I can't speak to what's available currently in Puerto Rico, but I can tell you what we can do, if that's okay. So we have the capabilities of any hospital that you have in this country. So we have full bunch of specialists. I have a CAT scanner, angio suite, and I have dialysis capabilities. The only thing we don't have on board is an MRI, because if you know MRIs, they don't do very well with metal, and you can see there's a lot of metal there that would probably interfere with that. So we don't have an MRI, but we do have a new capable CT scanner, ultrasound. We can run up to 11 ORs, but we're only going to be loaded for 6. The ship is built, the primary mission is for combat support. So the combat support mission is a little different package than humanitarian. In combat, we don't bring OBGYN doctors and pediatricians and neonatologists. In this tailored package, we have more community health, more primary care. I have a 50-bed ER capability on board the ship. I have the ability to store about 250 people, and we'll have up to 50 ICU beds. The potential of the hospital ship, actually, if it's made for combat, would probably be one of the largest trauma centers in the United States. If you Google it, it'll be number 7, because it has up to 1,000-bed capability. We're not packed on 1,000-bed because, again, our mission is not trauma for combat. It's more for humanitarian assistance. Well, we have the capability to the MSC command, who runs the whole part of the ship, has been a great partnership with them, and logistically we can run
for 6 months for combat without being resupplied for medical supplies. Food, we would need that. For humanitarian, because of the nature of the short notice and the flexibility, we don't know what we're going to face yet. We load for about 30 days of supplies. I have Navy sailors from Puerto Rico, including my admin chief, who is supposed to go on vacation next week to see his family in Puerto Rico, and they're fine, by the way. They're in the eastern part of the island, but they're okay. It took them a week to get a hold of them, but they're okay. There are also a number of sailors that have come on my crew, so it's like a nest egg. So I usually have about 58 sailors that sit here and maintain the shop. It's not in mothballs. If you know anything about equipment, you have to keep things running. All my lab equipment capabilities, CT scanners, radiology machines, required to be used, or at least turned on. And you can't leave them off for a month and come back and expect them to work. You guys all know technology, it's a bit fickle. So I have that crew. Then I have a critical core that comes on board, which is sourced from different 18 NTFs around the country. Majority comes from Portsmouth, which is local. That's 241 more people. That doesn't bring you a capability for medical support, but it's like a framework or bone structure for the hospital to get ready to take patients. And then the FOSS tailored package, which we brought on board, over 529 people were tasked with the mission less than 36 hours ago, some as late as last night, and they're here this morning to help support us. So as a doc, coming on board the ship and seeing the capability, it's really impactful and emotional what we can deliver. And thanks to the partnership with MSC Command in the Hull and Navy Medicine East and Navy Medicine and General BUMED leading forward, I don't think you guys understand. No civilian agency can bring this capability in 24 hours to be able to go on a ship, to go anywhere in the world, anytime, anywhere. And because of our capabilities, any deep port, we have two transports that you may see on a regular cruise line that can bring patients up as well, up to 40 patients at a time. Most cruise lines just bring things down, but to bring the load up to do that is a great capability as well. So we can bring them from the pier side, from small boats, if we can't get up further up into an area, or by the large deck can actually move in closer. Pier side does have some limitations, but we can be flexible and do almost anything. So when we're full to bore, we can process about 200 people per day, depending on our supply list. For combat would be 6 months indefinitely for that period of time. We don't know what we're going to be tasked with. We don't know what the medical ask is. That's from higher up national authorities or working with FEMA to decide where the base use of us, because we don't have I'm just a captain. I'm on this level. My job is to be ready to go with our team and get what we can to be as flexible or semper gumby as you want to be on the site. But those areas will have to be determined where our best impact will be. There's a great already a Navy asset, a military medicine asset on land. So we're going to plus up with them, and the captain, the Commodore, will actually give us, he's over there now, will give us the guidance where we're going to go. So wherever he says we're going, my team is ready to support and provide care.
Do you have a sense of like what types of aid might be in demand? Like for instance, like in an earthquake, you may see the preponderance of a certain type of injury. In hurricanes, is there generally something that you're expecting to see more of?
Well, we use a computer model base that actually can tell you what kind of economy you're dealing with, emergency economy, a well-developed nation type thing, and timelines. So depending on when you get and what kind of disaster, so whether it is a local disaster, the earthquake knocks a building down, or you may have a wider spread, so that you can then put these questions or input into the data and get an input. Normally, the first few days of an incident like this would be more trauma-related incident, things falling down, things being blown over or hit by debris that are hitting. As we further move out, there's more medical things. So as you lose some of the civilization type things, running water, proper sanitation, things like dysentery or cholera can also be on. So usually around day 14 through on, you'll start getting more medical issue, or medical patients who haven't seen their doctor or haven't got their medications refilled may have problems that may be due to their original disease. So again, trauma up front, and then as you go further out, it's more medical based. I'm sorry, she had a question next?
Anything a hospital can do. So if somebody needed...
Nearly.
Okay, so if somebody needed surgery...
Yes.
Are there things that you can't do? And then in that case, what happens then?
Well, there are certain surgeries we just wouldn't want to do. We wouldn't want to do a joint replacement because that's a long follow-on. Someone has a broken bone or needs a washout, yes. So one of the differences between this ship and some of the other medical capabilities, the L8DH, they can do damage control surgery and major surgeries to stop them, but they don't have the follow-on holding capability. So if we have a patient that has a contaminated wound and may have to go back to the OR 5 or 6 times over a week, we can keep the person on board and do that and do all of that definitive surgery.
What about the pharmacy? There's a whole pharmacy too, right?
We have a pharmacy based on, we call AMALs, which are packages that are pre-based packages based on what we think. We don't keep anything on the ship for the most part until we get an order to where to go, because we want to tailor our mission what we need. And we get support from MSC, from our civilian contractors, from Portsmouth, and we've actually called commands up and down the eastern coast if we don't have something we can get to pull. And all that's been loaded on. I mean, 98 pallets of food by my guys during a storm. The winds of the last couple of days here because the hurricane have been in there have made it very challenging. So it's been a heroic effort, a teamwork effort to provide a capability like, as the Commodore said, very few in the world can do. We have them on board now. So we've loaded them over the last 2 days. That's why we have the ROS 5 status. You have to get your mission and then task what you need, and it does take a few hours to do that.
Can you give us a sense of how much medication, how many supplies?
I have enough for 30 days.
Enough for 30 days. And can it be extended beyond 30 days?
Well, so one of the things as we get more information from higher authorities, as I said, we don't know what the full ask is. We have to be very broad. If we need to do more, say, dialysis or more so-and-so, we have the ability to say order up from the ship and order ahead and have redelivery, so we can do the underway replenishment. So we have those already scheduled for food, but we can add other things on there. Or we also have a hemodet on board that if we know where we can pre-position supplies to fly them out to the ship.
You said there are over 800 people on board. Can you give us a breakdown? How many doctors, how many nurses?
Well, I have over 300 of our finest Navy corpsmen, and those break down into specialists and techs. So we have lab techs, x-ray techs, pharmacy techs, physical therapy techs, and I have approximately 140 medical type officers. So that's doctors, nurses, MSC officers, which is not different than the MSC line command that does the support, medical service corps. So those include your pharmacists, your physical therapists. You may have also, we have nurse practitioners and PAs, and I have a number of I have at least, I have 45 doctors, and they don't count me anymore, unfortunately, on that list. But I have, my executive officer is also in internal medicine. So we actually have 2 additional doctors that don't count on the list because we're in a position that we're set for CO and XO.
Obviously, the mission that you do is critical, especially at a time like this. Do you anticipate any challenges that you can foresee now, maybe like a language barrier? Like, what are some of the challenges you are preparing for now?
Well, I have a number of people on board the ship that speak Spanish if we have that issue. You know, I've been doing this for a while, and I've had a lot of my mentors have always told me, if you get to do a humanitarian mission, it's usually the highlight of your career. And one of the joys is being a skipper and Admiral Swap, who's a NAVMED East Admiral, and the source for most of our, actually all of our medical's capability, was on board last night and this morning. And walking around, and normally you get deployment, there's always people like, oh, I can't go for this reason or that reason. The energy, the smiles, the enthusiasm to help is really rewarding to see as a commanding officer. It's really heart-touching to see that. And I'm very proud of our sailors, and I couldn't be more proud. I mean, it's almost like, put me in, coach, I can help, I'm ready to play. And they really had that enthusiasm. Getting on board last night, you know, it just takes time to process that many people across that little brow, fighting and berthing, and not one person was complaining. Everyone's smiling, happy, and just happy to be aboard. So it's really an infectious type thing. So they're really eager to help. And we'll do our best, whatever the Commodore has us do and the higher authorities to do, we're standing by to assist.
Comfort responded after Katrina, after Hurricane Rita, after the earthquake in Haiti.
September 11th as well.
September 11th. How does this particular crisis compare to some of those?
Well, each crisis is different. You know, September 11th had a focal point where it was gone. The natural disasters, and it's always a little more challenging working with the states because you also have to work with states. Those different states, governments, and FEMA actually will drive a lot of that, and a lot of the stuff's way above that. So we're just more of, tell us what you want, and we'll support what you need. Many of the states, though, actually have inland resources, so sometimes it's easier to move inland than to have to go out to sea. So depending on what kind of nation it is, or nature of the event, we're more in, tell us what you need, and we'll support.
And those 30 days begin once you make landfall in Puerto Rico, correct? You're not counting 5 days.
Well, the supplies for 30 days is what we need to do medical care. So when we start medical care, We will need food resupply. We have enough food for about 21 days for 900 people.
You mentioned the morale and the energy is really high.
Yeah.
Are there any challenges just in terms of throwing all these people together at once and like procedures? Maybe someone does something differently than someone else, and they kind of have to work things out, or is that?
No,
we're. Fairly smoothly?
It goes. Actually, it's amazingly. The teamwork approach is really a pretty good. We're all active duty, so we all worked in different. We were all plug and play, if you will. I've been deployed downrange to Iraq or as an ERSS team lead to different areas, and there are general training pipelines that people have, so a lot of it is consistent. People always have their certain preferences, like I like this type of retractor if I'm a surgeon, and surgeons always have their own little personal things they like. But I'm an ER doc, so there's always a little battle between the ER doc and surgeons. So.
How many people, medical staff are on the ship?
So there are at least 71 mariners. We may have a little more plus up for that actually run the hull. And on the medical side, I have over 800 right now. Well, that includes my support staff. So not just medical, I have a large non-medical component. So somebody has to feed people. So we have a galley that can provide up to 8,500 meals a day if properly stored. We don't need that much right now because we only have 900 people on board, times 3. So at least 3,000 meals a day we'll be cooking. So I need staff to do that. And then we have logistics supply orders. So I have barns and warehouses on here I can put stuff in, and a whole bunch of people, civilians and military, that work together to make sure we have what we need. So it's right now over 800 military staff, and then the 71 civilian mariners.
I'm sorry that you said this earlier. I do apologize. Is your ship equipped with dialysis? I remember
Yes.
watching the report. A lady said her mom was without dialysis for days. So.
Correct. So the ship has capability for dialysis. Like I said, it can provide them nearly anything any medical hospital, tertiary care facility in the States can provide, except MRI and usually some of the neurosurgical procedures, if you staff it right. So we always have dialysis machines. We've actually plussed up from Portsmouth with 2 other ones, and we actually have nephrology on board and dialysis techs to support. So the beds, or you have to look at that, it's 250 beds is a breakdown because you have, of that, 50 beds are in the ICU. So those 250 beds are varying level of care.
If I could ask everybody, obviously they have to get underway in 90 minutes, so we're going to go last question. Whoever can get it in.
In terms of once you've been victims on board and they're say in an ICU unit, how does the handoff work? Do they end up back in Puerto Rico? Do you take them to the States? Does it matter?
Depends what the condition is, and there's also people that have come from other islands from the previous storms that are maybe there too. So if they're a foreign national, we would work with the embassy and State Department to get them back to their host country. Puerto Rico actually is U.S. territory, so a lot of it depends on do they have other assets or resources anywhere else, or is Puerto Rico ready to take.
My name is Lieutenant Commander Kelly Nolan. I'm the commanding officer of Coast Guard Cutter Elm. We're a 225 WLB buoy tender based out of Atlantic Beach, North Carolina. Currently, we're on approach to the island of Vieques Mosquito Pier to deliver 14,000 pounds of bottled water and food supplies in the form of MREs to the people of Vieques. Yeah, so I believe it was about 2 days ago we had finished up our ATON mission down here in St. Thomas and Puerto Rico, and received tasking to visit the island of Vieques and see what we could provide in terms of fuel and water. It's humbling, and it makes the crew and I feel very good. Our primary mission is aids to navigation, and it's one of the less glorious missions of the Coast Guard, but one of the more tangible. At the end of the day, we can visually see the work that we did, but this humanitarian mission has touched us on a whole other level. Every crew member that got to speak with some of the locals yesterday when we pulled into the pier were just left with a sense of thanks and accomplishment. So it's been very fulfilling for the crew and I to participate in this mission. So we deployed in support of Irma first, and then made our way down here in support of the recovery efforts after Maria. The crew, they're rock stars. They're amazing. They will do anything asked of them, and they like working hard. I know they're tired. It's been several weeks of very long days, busy with operations, and they just keep going. It's a pretty amazing group of people.
Claritza Navarro, C-L-A-R-I-T-Z-A, and my last name is N-A-V-A-R-R-O. I live in el barrio Montesanto in Vieques, Puerto Rico. Okay. In the name of our group, it was a little group that we just started on the corner. In moving, we started with the one satellite phone that would make the difference, and that's what we made the contacts to other people, and then after that we get more satellite phone, and this is what you see the difference on all the big help running around here, and we just were screaming and yelling, hey, we need water, we need this, and here we go, and this is happening, and we are getting more and more help, and we are really appreciative. We're very happy. We're a friendly island here, and we are so pushing an energy to make this island back together, and I think make it better every day. So we are doing what we gotta do with the help of Coast Guard, FEMA, our health energy, and we're going to do it. And thank you.
Teamwork, like everyone's right. Let Coast Guard know what you all need, please.
Thank you.
They've been in here every day for the last 4 days. They started the communications for your medical supplies. You remember that? That was through the Coast Guard cutter Cypress, and it's just rolled on from them every day they're here. No, thank you guys. Appreciate it.
Great job.
My full name is Jeremiah William Ohms, and I am an Airman First Class.
Okay, and then how do you spell that first and last name?
Jeremiah-William-Olms.
It's a long one.
Yeah.
All right, so what's your official duty title, I guess?
So my official duty title is a Traffic Management Officer. Yeah, so.
That's logistics.
Yes, sir, LRS. 319 LRS here at Grand Forks Air Force Base.
Perfect. So what are you guys doing, and what have you guys done in the past couple of days to what are you guys doing basically?
So basically this was kind of really quick here. We're trying to help the relief efforts of Puerto Rico and the happenings that have been going on here with the hurricane and such. We're part of the relief efforts, so there's going to be a National Guard coming in, Army National Guard, I should correct that, to help us with getting the supplies, water. I'm not sure what other supplies they're going to be bringing in here, and we're going to get that as soon as we can here.
So what, have you ever done anything like this before in the past, or is this kind of like a first for you?
This is a first for me. I have not actually had anything like this happen yet, but we have had extensive training, and we're on call 24/7 for instances like this.
Okay, and during these trainings, what kind of like supplies and like relief items, what do you guys usually train with? Like, what are you guys getting ready here today?
So today, I don't personally know what we're going to be having come in. Like I said, it was a little bit of a fast kind of thing. I got the call last night, and we're working closely with our air traffic officers to get things moving here. They are going to help us with easing the process of getting the cargo to air quality, and that way we can get it to them as soon as possible.
Okay, so what's the process kind of like? Where does it come from? Like, is it on base now and you guys just kind of get it ready?
The supplies, they're actually, I assume they're going to be coming from the Army National Guard, but honestly, I do not know at this point. But we're going to, of course, expedite this as fast as we can.
So are you guys actually, so are the soldiers, are they coming up here and then what's
Yes, we're currently waiting for the aircraft to come in, and that way we can get a better idea of what's going to be needed and a little further supplies and what we can help them with, of course. But the plane has not come in quite yet. We're still on standby for that.
Okay, so basically they're flying in and you guys are going to help them load up some stuff?
Absolutely, sir.
Okay, all right. So how would you say that this is going to aid the hurricane survivors, and then like what are you guys doing to kind of directly help them?
This I feel is going to be a really major help to them. I know everybody over there is struggling to survive, I believe, and I think any little bit helps, and it goes a long way. So, I mean, honestly, if it's toilet paper or if it's just some rice and beans, water especially, it's going to help them out. They're an island, and I feel that it's definitely hard to get things imported into them.
Okay. Let's see. What else is there? Do we typically have this stuff kind of like on standby, ready to help out with, or is this stuff that was maybe donated in the last couple of weeks, or how does that work?
We usually do have some supplies ready for cases like this, but on the short term like this, I don't think that we've had all the supplies ready. I'm sure that there was some things set aside specifically for this reason.
So you said you've trained in the past for things like this. What have you guys done during these trainings? Like how's that kind of helped?
Well, so for training purposes, my job is to process the cargo and get it ready for shipment, and that way they know how much and of what, including the weights and dimensions of the item. That way it fits into the aircraft properly, and it'll actually get off the ground. So that's part of my job. The air traffic officers here are going to be assisting in making sure that the weight is distributed correctly in the plane, and that way it doesn't tilt or tip over, or of course fall out of the air while it's in transit. So
definitely, so there's a lot that goes into it.
Yeah, definitely. A little bit of a science.
Yeah. So I think that's all I really have for you. Anything you wanted to add, kind of?
No.
The mission of the Joint Task Force in Dominica is specifically to facilitate the evacuations of American citizens who got trapped on the island as a result of Hurricane Maria. We have a search and rescue capability that's out locating isolated Americans. Once they are found, they're brought over to Charles Douglas Airport. We escort those individuals into our evacuation control center. There, a team of Marines as well as State Department officials help process these evacuees and essentially prep them to travel back to the United States. The State Department is the lead agency here for the evacuation process. They've been providing that guidance for us as to, hey, we have individuals or pockets of individuals in these locations, so they drive our operations to find the Americans. And then once here, they're processing people, they're explaining how to get home. So really, we're enabling them.
The biggest challenge has been communications, like locating American citizens on an island that's pretty much been devastated by the hurricane, finding where they're located, whether or not they want to evacuate, and if they have any special medical conditions or they're elderly.
Generally, U.S. Marines, we're helping those who can't help themselves in foreign countries. but in this situation, now we're the face that's helping Americans. So it puts us in a really unique and a really gratifying role to be here.
¿Oíste?
¿Dónde tú lo mandas que a la sierra? ¿Acá arriba? Ya. ¿Qué es lo que se le da a ellos? ¿El número del vehículo? Le ganamos el seguro y el número del vehículo. Tierra.
suyo, señora.
Sí.
Pero no fue a Mallita.
So you got one LMTV up. Got the.
Let me know what division you get, because a lot of these units in there, they...
We are in the process of staging one of our engineer companies to go to Puerto Rico to help them working for the 105th Engineer Battalion out of North Carolina. So this is a composite battalion that's coming out of a lot of different states. But we're sending about 150 people, and this equipment behind you will be going over on a boat shortly after our soldiers leave. All of these soldiers that are going over, highly experienced, both in austere conditions, in combat, and also in relief operations. And we're expecting great things. Our heart certainly goes out to the people of Puerto Rico. Great devastation down there, great hardship, and we're just proud to be able to have the opportunity to help them in this time of need.
We've done this twice.
We were tasked with providing food and water to local community in the east part of the island, and we met up with the local mayor there, and he requested assistance from us to pass food out and water. We assisted local emergency medical personnel as well as police officers because they needed the assistance, and we identified a sector that had a certain amount of families around that we could impact the most, and we started passing around water and food.
Our expectation, or what I expected to see coming into the community, I expected some damage, but not to the extent that we experienced yesterday, that we witnessed yesterday. It was, people lost everything in their houses. They, everything. They just, the only thing they had it seems like whatever they were wearing, that was left.
Looking at the homes and seeing where the water line was pretty much chest level for me, it was definitely a challenge to keep it together.
When we started distributing the supplies throughout the community, I was sad. I was sad looking at the conditions that the people were going through. Everything that they own, it was out on the street. You know, you have kids, you have elderly women and males.
Being in the community, usually whenever we're in TAC gear or anything like that, and you see cop cars or federal cars, people are hesitant to come out. And initially when we did the run yesterday, you could see the hesitation as they started seeing us taking the cases of water and the cases of food directly to the homes, hugging and saying hi to everybody in the community. They started opening up, and people actually started coming with us and assisting us to give food. So it definitely went from a kind of a hesitation to open arms and helping us out. So it was a tremendous opportunity to interact with the community.
I'm just happy to be here, man, and helping and just making it better, you know. I know it will take time. It's not something that we're gonna come out of this like, you know, right away. It's gonna take time, but I can see my people surviving this and continuing on like we have done for many centuries, I guess. Puerto Ricans are strong, and we don't let something like this take us down, not for long.
The chief of the National Guard Bureau, General Joseph Langell, visited Puerto Rico on September 27, 2017. His short visit was to assess the situation in the aftermath of Hurricane Maria. He met with the Puerto Rico National Guard Higher Command, where he also sat with the Governor of Puerto Rico, Honorable Ricardo Rosselló. After the meeting, he flew with Governor Rosselló to Camp Santiago Training Center in Salinas, Puerto Rico. At Camp Santiago, they were met by several news outlets and by the mayor of Salinas, Honorable Caroline Bonilla Colón. Mayor Bonilla received food and water supplies from the National Guard for her municipality. General Langell also flew around the island to observe the devastation left by Maria. Reporting for the Puerto Rico National Guard's Public Affairs Office, I'm Army Sergeant Marimar Rivera Medina.
Come on, gather around. If you're heading out, I just want to say a few words to say thanks for what you're about to do. Puerto Rico is a tough place to get to. These are our citizens suffering right now. All right, so y'all ready to do this? Cool. All right, good luck to you, all right?
So yesterday at 12 o'clock, we kind of got a notification that there's a possibility we were going to be moving. About 6 hours after that, we were told, yes, we are moving out. And we moved full force as fast as we could. We had over 60 people pushing our vehicles and equipment through to get them ready to be staged to move to here. Their attitudes and morale were just great. We stayed up almost 36 hours as of now. So for how much they've been awake, they've got smiles on their faces and they're ready to help as best as they can. We're going to account for all of the Title X soldiers that will move down there to support Puerto Rico and their recovery operations to rebuild. Excited for the opportunity to help them because of the devastation that they felt. I think it's going to be a great asset for us to be down there and help them. I hope that we can be as much help to them as they need right now. We're always ready. 10th Mountain Division gets called on and we're always ready.
The mission of Beachmaster Unit 2 is to establish beaches for the use of LCUs, landing craft utility, used by Assault Craft Unit 2. Typically for the beginning of a beach landing, we're going to be pre-boated, loaded already onto one of the craft. So we roll off first with these craft we have called LARCs, lighter amphibious resupply cargo 5-ton. We use those for seaward salvage and the first thing to go ashore. We also bring along a bulldozer, a 7-ton truck, and a Humvee for communications. And that's typical for the kind of operation we're doing here. We establish the beach, set up perimeters, control security of those perimeters, guide craft in and out, and then control traffic of rolling stock and any other supplies that may need to be brought ashore to support the mission, then can guide them on to their objectives. We're using a concrete ramp, so we have less work to do in terms of the actual preparation of the beach, but we still have to support the movement of vehicles onto and off of that ramp. I've heard the chain of command on the Kearsarge talking about how every sailor on board the ship needs to be aware that they have a role in supporting this disaster response, and personally I feel very fortunate in that we've been able to take an active hand in getting disaster relief equipment ashore. Just taking a look around these islands and the operations we've been conducting, there's been so much devastation in the wake of 2 hurricanes, and I'm pleased that Beachmaster Unit 2 has been able to come out here, get equipment ashore, and hopefully bring some much needed relief to the people of the U.S. Virgin Islands and Puerto Rico.